Hello everyone. Hope everyone is well. For those of you that are in America, I would just like to say that I heard today that there was an earthquake in America, so my family are in America as well, so I hope that you're all safe and well, okay? So welcome everyone to the live training, which is about what is involved in submitting your CQC application. Now, there's a lot involved in submitting your CQC application, and when you are looking at submitting your application from a point of view where I've submitted multiple applications, for example, for our clients, as well as for myself, and being a multiple seven-figure care business owner many years ago, I know that things always change and they're not the same. I don't know if anyone's been here where they've been doing this a long time, for example, and you know that things do change from time to time with the Care Quality Commission. Before it was C-Sky, for example, and before that it was the councils that you were registering with, and back then it was a voluntary registration. You didn't have to register, for example. So things have really evolved as we're progressing, and I hope everyone can hear me fine. If my team can just let me know you can hear me fine, that's great. I just want to say hello to everyone as well, and thank you for being here. So like I said, you know, coming from where it was a voluntary registration, for example, and at that point I registered voluntary, and then I submitted my evidence that I was able to have a safe care business, for example, whether it was my home care business, whether it was my nursing agency where I was registered with the C-Sky back then to provide nurses in the community. And so I had that alongside my home care business as well. So I just think it's really important that we just talk about from where it really all started, you know, and we've really progressed on to such amazing things now where we're actually focusing on the service user rather than those that regulate us. Even though that's still important, we're now including service users in everything to do with registration, for example, to a degree. So today is going to be about discussing that with you today. So let me dive in with you all. I've got some notes because it's all a long information that I'm going to be talking to you, so I wanted to keep focused and not go off into a different direction. So I just want to, you know, really go through it with you all today. And as providers, we really do have to really pick up our socks. It's basically, we really do have to be looking at getting registered. They really want to, even though some organizations you don't need to be registered, for example. However, with home care, you must be registered in the community if you're providing home care. However, if you are an introductory agency and you're providing personal assistants who are self-employed, they're not employed by you, they're not employees, they are like contractors, for example. So with regards to the overview of the Care Quality Commission, the framework is hereby where the Care Quality Commission is updated its frameworks, and they do this periodically, like I said, to ensure that they stay relevant, effective in the face of the needs of the service user. Also, there's technology now that we're looking at as well. That's a whole thing that's being introduced into the mix as well, and the practices that we do. So these updates, they are vital for maintaining high standards of care across all healthcare services in England, this is. So this decision to update the framework, it really stems from several key factors. So what I want to say to you all is just grab yourself a pen and paper, make notes, because you're going to need this. For example, it helps you when you're writing things down as well, so that you can, understand what's being said to you and try and work it out into the way that you would use the information I'm about to share with you today in this tutorial, for example. So, but I go back to, like I said, the reasons for updating the framework is that there's a change in healthcare landscape needs. The needs are changing. There's advances in medical technology, AI, for example, changes in healthcare delivery models, and the evolving needs and the expectations of the population itself really does demand regular updates to regulatory frameworks to ensure it reflects current practice and standards and those that use the service, because our needs change. Things change in the environment, for example. So, especially after COVID, it really has changed a lot, for example. So, learning from experience, the Care Quality Commission, they drew lessons from regulatory delivery activities, including inspections, reports, feedback from patients, families, and healthcare providers. So by doing this helped them to really redefine the framework to address those gaps, to improve clarity and increase effectiveness and regulations. Now, there's some bad practices that went on, and there are some, good examples, for example, of what not to do, but I'm not going to discuss that here because I don't think it's appropriate for me to discuss other organizations' bad practice, but you can have a learning from that in our trainings that we provide that to you, for example. So, like I said, it's about learning from the experience of what worked well and what didn't work well. And I think it's really important that we really think about our own healthcare business and draw from this, okay? So there were changes in health and social care policies, as well as legislative updates. This often required adjustments in the CQC regulations approach to align with new legal requirements policy and its objectives. And this also included the quality and safety enhancements. So ensuring that continuous improvement in quality of safety of the care was the core goal of CQC. Updating the framework allows the incorporation of new standards and best practices to drive improvements across the sector. Innovations, we've got this, and adaptations, obviously. The healthcare sector is rapidly, the AI and all the new treatments, the digital health technology is really coming into strong force. Service delivery models, they're emerging, they're evolving. And the framework must adapt to accommodate and encourage innovation whilst ensuring that you, the provider, maintain and enhance quality and service user safety. So, like I said, the implications for healthcare providers are the adaptations to the new standards. You as a healthcare provider must familiarize yourselves with the updated framework and assess their practices amongst the new standards. So what practices are you currently doing at the moment? Does it match the new standards? I'll go into that. So this may require you to change your procedures, what you should do, training of your staff members, and updates to policies and systems to ensure compliance. So there's an enhanced focus on person-centered care. Person-centered care has been around for a very long time, the word, okay? It is not a jargon, it's not a buzzword, it really means something. And with CQC placing a stronger emphasis on person-centered care, providers will need to ensure that care plans are tailored to the individual's needs and preferences as well. This involves them, the service user, in making decisions about the care that they receive. They want to be involved about how they want their care to be received, not just a social worker or integrated care boards, for example, or you as the provider just taking over and thinking you know what's best for them. They need to be able to have those choices and make a decision. So there's increased accountability. So this updated framework, it is more rigorous, and the accountability and transparency has also increased. So you will need to be prepared to demonstrate your performance and the outcomes more openly, engage in constructively, giving feedback during your inspections as well. Thank you. Thank you. So what you need to think about is encouragement. These are the things that we need to start implementing into our home care business. So you want to use encouragement of innovation. So as this framework, it adapts to support innovation in healthcare, because you're going to come across it if you haven't done already. You, the provider, will have the opportunity to implement those new technologies and practices. However, you must also ensure that you're meeting the regulatory requirements associated with these new innovations. So ensure they contribute positively to care, quality, and patient safety. Hope everyone is enjoying this and you're making some notes. I'm just going to drink my water. Hashtag if you're watching live, hashtag if you're watching replay, so that I know. So another part of this framework that's been introduced and included is looking at continuous improvement and evaluations. So you, the provider, will be expected to engage in ongoing evaluations and improvement of their services. This includes not only responding to identified issues, but proactively seeking ways to enhance care quality and patient experience. So you always got to be evaluating continuous improvement, for example. You've also got to be looking at integrating, and this is how you can do this, is by integrating person-centered care into your daily operations of your healthcare business. This requires a strategy. It has to be strategic. It has to be thoughtful approach that touches on every aspect of patient interactive service user, for example, and care delivery. So I'm going to talk about some of the steps that you can use to ensure that you're providing a genuine person-centered care. So one of them is your training and education. So you want to provide your staff with the training on the principles of person-centered care. You want to be emphasizing the importance of empathy, respect, and the individual's needs of the service user. You want to ensure that you're doing ongoing training that incorporates person-centered care. It's not enough for someone to just have their level 5, for example, or level 3 or level 2 or even the care certificate. You've always got to keep upgrading and updating your staff with training, for example. Okay, so this includes you could do training online, talking about person-centered care with your staff members, for example. There's also another way is your policies and procedures will need to reflect, and you'll need to review and examine your existing policy and procedures to ensure that they align with person-centered principles. This may involve updating your care planning process, communication protocols, and feedback mechanisms like your quality assurance. You speak with the client, you speak with the service user, and ask them how things are going. You know, what's your feedback mechanism? Is it a telephone call once a week, for example? You should be doing that. Someone should be calling at least once a week, the service user or the relative, to just ensure that you're getting positive feedback, or if it is a negative feedback, then you'll rectify it, you'll sort that out, and you'll be able to act quickly, for example. You want to incorporate flexibility. Now, this ensures your policies allow for flexibility to tailor care plans to individual service users, for example. Their preferences and their values is important. The next thing you need to think about is the care planning and delivery. So you've got your individual care plans. You've developed a care plan based on the thorough understanding of each service user's unique needs. They're not all, everyone's not the same. We're all different. We're human beings, but we're all different. Okay? So we don't treat everybody the same. We have to treat the individual as what we see and what the communication is that we get back from them to see what decisions they want to have regarding their care. Don't treat everyone as the same. You want to give empowerment. You want to give them empowerment and choice. To empower patients by offering choices and involving them in decisions about their own care, because they're the ones receiving the care, not you. You're delivering the care. Ensuring that they understand the options and the implications of their decisions. And you know, if anything seems a bit high risk, then obviously draw it to the attention of the organization that you're working with, or possibly you could talk with the client itself. So you want to ensure that you're communicating and you're also engaging. So effective communication. You need to train staff in effective communication techniques, emphasizing active listening. The staff member, they really do have to make sure that they've listened, not just go in and start taking over and going, hello, hi, oh, I've had a busy day today, right, okay, I'm just going to get on with things. Listen, active listen to make sure and get the service users' feedback. Don't just go in and take over. It's their home. So yes, you're going to look at the care plan, you're going to see what's happening, but there's a person in front of you that you need to talk to. It's okay, yes, you're going to look at the care plan, but at the same time, you have to make sure you're present with them and you're focused on them once you walk in the door. Don't be thinking about, oh, I've got the next call in 15 minutes, or I've got the next call, oh, that call that I did before, I've got to inform the manager, when really that should have been done beforehand. So you want to encourage your staff members to really be listening to the service user, because sometimes staff members tend to take over and talk over the service user rather than talk with them, listen to what they've got to say. So be clear. You want to ensure that the language that you're using is jargon free. Okay, no technical thing. You just want to be down to earth, just like the same as the service user will be. They want jargon free language, nothing technical. Save that for when you're dealing with social services or CQC, for example. Okay, so engage patients and families. You want to encourage dialogue with families, with the patient, ensuring that they feel heard and valued. So you want to ensure that you've got various channels for feedback and engagement as well. This will let them know that you're working with them. Now you could have something on your website whereby they fill out a quick form, for example. Just drink my water. Of how they found the service. Are they happy with the service, for example? So going back into this, so you need to look at speaking with external healthcare providers and community organizations to support holistic integrated care. So go and visit your community, find out what is happening, find out what the what activities is going on for the age group that you want to serve, and maybe you can join and go in there to meet them as a local healthcare provider, because they need you too. So why not arrange to go and do a talk or an activity? For example, you could go into a care home, you could go into a sheltered housing, for example, supported living accommodation, for example, and offer these services. Collaborate, because if you don't collaborate, then that means you just stick into your little circle, whereby it's just you in the business, running your business 24/7. I'm talking to you because I know I've been there, worn the t-shirt, for example. So by going to visit your neighboring so-called competitor, because you're not a competitor really, it's just you think you are, because there's plenty of work for everybody. You just got to make sure that you understand and that you've got the right information, and that you can articulate yourself when you're speaking with those organizations that you want to collaborate with. It could be GP surgery, it could be social services, it could be integrated care boards, for example. It could be charities that specialize in elderly care or dementia care or Age UK, for example. There's lots of different organizations you can reach as well. So when you're doing your CQC application, then you need to show that you've spoken with various organizations, or you've emailed various organizations, and then that then is put down as evidence. But you also want to speak with your community to find out what the current needs are, what are they struggling with currently at the moment, so you can help them with providing your home care service. So think about collaboration, coordination, and then you want to look at the, like I said, the external partnerships. Work with external partners, including healthcare providers, and there's also community organizations to support the holistic integrated care. Another thing you need to be thinking about is the environment and resources. So this is all going to be all part of your CQC registration, submitting your application. There's going to be some questions around this. So adapt to the environment. Ensure that the care environment is welcoming. So when you're going into service users' homes, then yes, you'll be going into their environment, okay, and you'll be looking at meeting their needs of that individual. And this includes considering privacy, accessibility, and personalization. There's nothing worse than someone being on a bus, for example, and they're discussing a client's care. That is not adhering to the privacy. So you breached privacy, for example. You want to look at, I'm giving you all some examples here of what to look out for when you're submitting your CQC or when you're going through your inspection. This is a two-way thing here. There's the one way you're going to be submitting your application for CQC, and then there's also providers that are already up and running, but they're due for an inspection. So you need to make sure that you have these things in place. So you want to also look at ensuring that you've got adequate resources. This includes your staff, technology. So you want to make sure that you've got enough staff members. So for example, if you say I've got 50 staff members, out of those 50 staff members, there'll probably only be 25 that will actually do the work. For whatever reason, it usually seems to be that way. So you've always example. And I was recruiting weekly, and I would suggest you to do the same, that you recruit weekly, because if you don't, then you're going to become unstuck, whereby you've got a client who needs a service and you've got no one to cover. Either, you've got to really look at making sure you've got someone to cover that shift. So like I said, you've always got to keep recruiting. So when someone's gone off sick, who is going to cover? Have you already arranged for someone to pick up a call? Have you already spoken with the staff members to say, hey, what's your availability this week? And then you write it down, so you know that on a specific day, that if someone goes off sick, you can use this person to go and deliver the care. So no one's left vulnerable, for example. So allocate your resources. You want to ensure that they are adequate resources, including your staffing, like I said, but also your technology. The technology needs to be safe, because what's going to happen with this technology, if your systems, for example, crash, what will you do? What is your backup plan? Okay, i.e., you've got a rotor, you've got software, and that crashes, you can't access the rotor, then that's going to leave someone vulnerable. So what backups do you have? You've got also, it could be your internet just goes like that. What backup do you have? So you would have, for example, a on-call sheet. You know who's on call, but at the same time you also have a list of all the staff members that are currently out in the field and who's covering the calls, so that if someone goes off sick, or they're running late, then you know what to do. You've got the list, you've got the rota list, you know that the shift can be covered. So you're not caught unaware because you've printed off your rota. So looking at measurement and improvement. So you want to implement a system to regularly collect and analyze feedback from service users and their families as well, because that's important, about the care experience that they receive. So you've got to show evidence of that, how you're going to submit that information and provide that information to CQC, for example. There's also continuous improvement. Like I said, you want to use the feedback and outcomes data to identify for improvement and implement any changes. You want to engage staff in any problem solving innovations as well to enhance the care quality. So looking at the feedback mechanisms, you then got the data of the outcome from that feedback that, for example, 80%, 90% were happy with the service on this particular week, for example. Right, so what happens with the 20% of those that said they're not happy with that service that you're giving? What do you do? So then you would arrange to have a meeting to discuss things. So you will identify any areas for improvement. You can implement changes. You can also engage your staff members in that problem as well, just to go through with them to get their feedback. Because we're now, like I said, we're now more of a heart-centered community because of what's happened with COVID. We communicate more. We understand things more. So with your feedback, you've got the feedback, it's going to enhance the quality of care. There's also culture and leadership as well. So you want to lead your organization or the registered manager, for example, at all the levels. And this should embody person-centered values, demonstrating respect, empathy, and commitment to the service user, for example. You also want to cultivate a supportive culture. So build that value that rewards the person that is delivering that person-centered care, for example. So you want to encourage staff to take initiatives and share ideas with you about improving practice. Have a monthly meeting, for example. It doesn't need to be face-to-face. It can be online, where everyone's at home at a certain time and everyone can listen, for example. So what is the single framework that has been implemented by CQC? It's key questions, which involves quality statements and related regulations. So the assessment framework is made up of 5 key questions. And also there's under each key question, there's a set of quality statements. So the 5 key questions are you safe? Are you effective? Are you caring? Are you responsive to people's needs, for example? Are you well led? And the care to do with the quality statements, this is a commitment that providers, commissioners, and systems leaders should live up to. This is expressed as we statement. They show what is needed to deliver high quality, person-centered care. The quality statement shows how services and providers need to work together to plan and deliver high quality care. It's so important that we work together and not criticize one another, and to be able to think of the service user who is central to everything that we do. They are everything around care. So in order for you to deliver, you've got to have high quality care. This is about high quality care. And this relates to regulations listed. So the regulations we would also consider in our judgments are shown in brackets. So when we refer to people, we mean who use the service, their families, friends, any unpaid carers. This also includes people with protected equality characteristics. Those most likely to have a poor experience of care or experience inequality. So the importance of people experience is the assessment framework focuses on what matters to people. So we encourage that as those that are using the service, and you as the organization, for example, that you represent them or act on their behalf to share their experience at any time. So we also look at defining the person's experience as a person's needs, expectations, their experience and satisfaction with their care, support and treatment. And this includes access to and between services. So people using those services, their families, friends, advocates, are best sources of evidence about lived experience of care. This includes their perspective of how good your care is. So it's to ensure that people's experience are highly sought after, and also that you have sources of evidence to weigh them up equally with other evidence categories. So always make sure that you are, keeping notes, and that you're able to, excellent, and that you're able to give that evidence for when you are being inspected. Whether it's CQC, whether it's the council, government organizations, whoever it is that you're contracting with, they're going to want to see, if it's to do with home care, for example, they're going to want to see your evidence of how you're going to do these things that you say you're going to do. And is that implemented in your business? So just think about that for a moment. So I want you to consider the content and the impact of people's experiences with your analysis, for example, as well as CQC. They'll have their inspections, and then they're going to gather the data and make sure that you've met all of the criteria. If not, they will mark you at a certain level, for example, or even fail you, for example, and then you have to reapply again because you didn't meet the standards. So they have to make sure that you're ready to receive, because if you're not ready to receive, then you will fail. So with the feedback that people have, you want to ensure that it's not pure, a poor experience. You want to identify any concerns straight away, and then you will need to review further, and then you can also gather more evidence. This is to look at the evidence sources and whether you've identified or indicated any issues from that data that you've gathered. So the Care Quality Commission, they've increased their scrutiny and support for how care providers and systems encourage you to enable and act on that feedback. So this includes feedback from people who face communication barriers. How do you get feedback from someone who has communication barriers, for example? You want to look at working with your organization to improve. So people's experiences are diverse and complex, and you need to be able to analyze the range of services that you're providing so that the data is demographic according to where you are, but also looking at any inequalities and frequency of the use of your care services. So when we're looking at framework, it sets out clearly what people should expect in a good service and what it should look like. People's experiences of care is at the heart of CQC's judgment as well. That's how they judge the care that you provide. So make sure that by gathering and responding to feedback is central to your expectations to pass as a provider, because you have the systems in place. So an I statement is considered to listen to people, to inform the decisions that are being made, to take appropriate action based on the experience of care, so that we have a set of clear definitions of quality and safety based on what people say matters to them. And this is used consistently to people who use your service and at all levels of health and social care. So you can check out as well strategic measures. So you want to ensure that you're developing a quality statement. To develop a quality statement, you want to use, there's a thing called Making It Real framework, for example. Okay, this was introduced by a local act, for example. Okay, so looking at this as a framework, you want to look at Making It Real framework. Look at that and then look at how you can introduce that as well. So you want to be able to support personalized care for people who use your service. You want to support people working in healthcare and housing, for example. The I statements from Making It Real to each of your quality statements. So they can be used to help people understand what good experience of care looks like to them, the service user. You want to gather and assess evidence under the people's experience, for example, and their category. So the category could be mild, medium, high needs, for example. Could be complex needs. What category? Could be age as well. So how do you use the I statements in the regulation? So you want to look at the assessment framework. They reflect people and what they've said to them. So what they have said, it matters to you as the provider. So the key role in people's experience is to gather, listen, and act on people's experience. Their experience of care will inform CQC about the decision making and lead us to appropriate action. And this applies to all of their work. So let's look, there's quite a few things here. There's also the importance of human rights in approach as well. So with the new framework, it enables them to CQC to focus on people's human rights and when they received health and social care, for example. It helps to prevent failures in care that are often related to risk to human rights and to ensure people receive good care. The quality statement in the assessment framework are aligned with human rights principles: fairness, respect, equality, dignity, and autonomy as well. So when the CQC, what people tell them when using the service, the human rights principles feature strongly in that. The Health and Social Care Act regulations are also designed to be compliant with the human right law. So the assessment framework and the regulations also help legal compliance. This includes, for example, Equality Act 2010, Human Rights Act 1998, for example, and it should be a priority for CQC and the commissioners, ICB boards, providers, and their staff to protect and promote people's human rights. So people's experience of health and social care, this means that we will listen to gather people's experiences, feedback from your staff, from leaders. This supports you to listen more effectively to the experience of your frontline staff. You can take action, they will take action sooner to protect the rights of people using services and staff. So it's now also introducing your staff members, introducing your collaborations, who have you collaborated with in order to build this home care agency, for example. You know, it takes people, doesn't it? It takes manpower or woman power, for example. So the human rights approach is you want to look at essential links between care that respects human rights and quality of care. So how will you develop and approach human rights in your regulations? So I'll give an example of SAFE. SAFE. Okay, so example is with CQC. This is their words from their CQC application. Okay, so it says SAFE. So learning culture. So CQC have said on their portal, for example, where you apply for registration to become a provider. Now CQC have undergone some changes on their website, so It's a completely new portal. You can't go on the old portal. You have to go onto a new portal, and then once you go into that new portal, you then got to create an account if you are a new provider. Okay, so bear that in mind. Things have changed on their website quite recently. They changed it, I think, the beginning of March, middle of March, and I think it's taken a couple of weeks to get it sorted out because there was a bit of a glitch, and it was a bit sometimes confusing when you'd go on there because you couldn't see a link to submit. Okay, so I just wanted to mention that to you. So now it's sorted, as far as I know. It's sorted because I've been doing it, so I know it is sorted. And you just have to make sure that you click the part where it says create your account, but you have to go onto the new provider portal, not the old one. Okay, so one of the questions here to do with SAFE, it says learning culture. So on the CQC portal, it says we have a proactive culture of safety based on openness and honesty. Concerns about safety are listened to, events are investigated and thoroughly reported, and lessons are learned. So we identify and embed best practices. So now CQC says, explain how you will meet the regulation. Include the following: proactive culture of safety. So, for example, we will establish and promote a proactive culture and safety with your organization. This could include instilling a mindset amongst staff members that prioritizes safety and encourages them to actively identify and address potential safety concerns before they escalate. Regular safety briefings, training sessions with your team, and communication channels will be utilized to reinforce this culture. Openness and honesty. We will foster an environment of openness and honesty where staff members feel comfortable about expressing their concerns about safety without fear of reprisal. Because, I think some staff members were keeping quiet because they were frightened that they would get into trouble for some reason. So we want to encourage staff to feel that they can come to us no matter how big or how small it seems. Because if it's about safety, then we need to make sure that we have openness, that the staff member can come to you if they've made a mistake, if they've made an error, then they can come to you and tell you, and that you can act quickly rather than finding out from the service user or the family members, for example, or social services. Because when that happens, it gets really challenging for your healthcare organization. Okay, so make sure that you encourage your staff members to be open and honest. Okay, and this will achieve through regular team meetings, like I said, one-to-one discussions with the managers, and they can also report anonymously where staff can raise concerns about confidentiality. So you also want to be listening to concerns. So you'll ensure that concerns about safety are raised by staff members, service users, or their families are actively listened to and taken seriously. This can involve implementing clear procedures for reporting safety concerns and designing designating responsible individuals to investigate and address those concerns in a timely manner. Now, every council, for example, has a protocol, a safeguarding protocol, and you must follow that. The name, if there was a safety concern, then who would you report to? Yes, it reports to the manager, but then the manager then has to also report it. And each council, like I said, has a safeguarding protocol that you must follow. You must go to your website, the council's website, of where you are delivering that service, and make sure that you know where that is, what phone number, what email, what is the protocol. Download it so you know what to do in the event of an emergency, because there's nothing worse than suddenly someone calls you and you're like, oh, who do I call? And you got to have that straight away, and that's part of that. When you're being registered with CQC, they're going to want you to know and tell them where it is. They want to see it on paper. Okay? They also want you to be able to say who they are, so that you can instantly think in an emergency what to do. Okay? So, obviously there's the police as well. So this would involve having clear procedures for reporting any concerns. The responsible individual will also investigate and address the concerns in a timely manner. And this will be through investigation and reporting. Any safety related events or incidences will be thoroughly investigated to identify the root causes and contributing factors. You need to detail the incident report, and it needs to be well prepared. So the documentations, the findings and the investigations, and any corrective action that was taken. So think about when you are writing your CQC application, submitting, think about how you're going to answer these questions, because there's the quality statements in with the 5 key elements. Is it safe? Is it effective? Is it well led? Is it caring? Is it responsive? There's also these other questions which tie in together. They're not duplicate, but they just tie in together, so it covers everything. They're trying to make sure that they've closed all the gaps that was there before. So you would go on to saying, what is your commitment to improving the safety practices and procedures? What would that involve? It would involve regular reviewing and updating your policies and protocols, right? So based on any new information, your feedback from staff and the service users, and the changes in the regulatory requirements. Your staff will be encouraged to participate in ongoing training and develop opportunities to enhance their knowledge and skills related to safety. So this is how you would be explaining how you would meet that need. There's safe systems. What safe systems do you have in place right now as a care provider? Just drink my water. So you'll be working with organizations, for example, other multidisciplinary teams, partnering to establish and maintain a system of care to manage, monitor, and you'll assure safety. And you'll be ensuring that there'll be continuity of care. Okay, so what does that involve? You want to ensure that you've got a backup for when a staff member goes off sick. Who else is going to cover that call? Or even if the staff member goes on holiday, for example, who's going to cover? So usually you have 2 or 3 people go into the same client, for example, so that there's no vulnerability of not having their care covered. So you need to look at how you're going to explain to meet that regulation as well. So maintaining safe systems. You want to look at collaborating with other service users. I'll start again. You'll collaborate with service users. I'll start again. You will be looking at how you're going to be communicating with service users and their families and partners, for example, to establish a robust system of care that prioritizes safety, continuity, and this will involve a clear protocol of procedures, pathways to ensure seamless transition between different, when you go into service users' homes, they're not all the same. Everyone is different. So you've got to adjust according to the individual, the service user that you're delivering the care to. You'll also be looking at going into more, regular monitoring and evaluation of your systems to conduct the identity, to identify any areas of improvement and to ensure compliance with your regulatory standards that have been met. So you need to make sure that you've met those regulatory standards from the Care Quality Commission, what they've asked you to do, basically. So you want to ensure as well, there's another section here, supporting people that are transitioning between care providers. So what do you do when someone is moving? Sometimes that happens. They're leaving you to work with another agency. You're going to be supportive, right? You're not going to make them feel bad because they don't want to work with you anymore. They want to work with another service provider. So you also want to look at maybe they're going into a care home rather than being at home. So there's all different reasons. So how will you help them to transition into being with your organization and being with another organization? Okay, so you'll be working together, won't you, with the care provider? So you'll be having open communication. You'll talk about their current care that they're currently having. You'll also be discussing the new provider, and you'll ensure that there's continuity of care so that when the transition happens, it's just a natural flow. There's no change apart from the person. The care is still care at the end of the day. They're still getting what they've asked for as well. So you want to look at the information and guidance that you will be provided with so that the individuals and families understand the availability of the care options. Help them to make an informed decision that align with their needs and their preferences. If you're not able to meet their needs and preferences, let them go to someone who can provide them with that. Maybe it could be geographical considerations. How will you deal with that? So you'll be looking at helping the service user. They could be moving from London to Nottingham, for example. I'll just give that as an example. So what can you do that's going to effectively meet their needs and provide appropriate care and support? So you as an organization, you'll do assessments to determine the availability of the support networks, the community, the resources, the additional services that may be beneficial to the individual that's transitioning into care. What can they do? What activities can they do? What is in the community? Where else can they go to talk to people that are in the same age group as them, for example? Of course, safeguarding is always key. It always is part of healthcare. And that is working with people to understand what being safe means. That's the Care Quality Commission. They're working with you. And you also need to understand what safe means. And you look at the aspect that people have the right to be protected, to live freely, to live safe from bullying, harassment, abuse, etc., discrimination, avoidance of harm and neglect. So this is a question which they ask. Explain how you will meet that regulation. Include the following in your response, for example. And it says, we will engage in open and transparent communication with service users to understand their unique perspective. What safety means to them. So it will involve actively listening to their concerns, preferences, priorities regarding their safety and well-being. You'll have assessments, regular assessments, for example. You'll also you'll ensure that the service user who's vulnerable, that their safety is not compromised in any way. However, they do have the choice to also make those decisions. And the information that you will use, this will be used to be put into their personalized care plan and interventions tailored to meet those individual needs of service users. You'll be collaborating with partners. You'll work with collaborative partners, including other healthcare providers, local authorities, advocacy organizations. You'll identify and implement best practices for safeguarding. There's also the protecting the rights and preventing from harm. You as the organization will be using and taking proactive measures to protect the rights of service users and prevent harm in all forms, including what I've mentioned, the bullying, harassment, abuse, discrimination, avoidance of harm, neglect, and many, many more, for example. So the staff members, they'll need to receive training. This is all how you're going to be answering a question, for example, and recognizing signs of abuse or neglect, reporting procedures. You've got safeguarding and protocols that you're going to put in to your answer as well. There's there's governance, there's lots of all the regular things, but these are the new things that I'm talking to you about. You will also equip your staff members with the knowledge and skills necessary to intervene effectively and advocate on behalf of the service user in a situation where their safety may be compromised. And it's important that you do a timely reporting and response. You need to have clear procedures for this, for reporting the concern. You want to ensure that all staff members are aware of their responsibilities, because they need to be trained as well how to act quickly. Because if they haven't been trained on that, then the harm could be made even worse because the response wasn't quick enough. So, for example, the staff member needs to make sure that they report any concerns or incidents relating to the following, which is what I said previously before: bullying, harassment, abuse, for example. Additional, you'll need to provide ongoing support and guidance to members of staff to help them navigate any complex safeguarding issues. Because they need training. It's not just about having a quick basic training. They need thorough training on this. So it goes real deep, in depth. And there's lots of training providers that do trainings like this so that you are abreast, and they will keep you abreast with the safeguarding, for example, training that your staff members need to have. So as a home care provider, you will meet the needs. I've just showed you a small example. You'll be able to meet the needs of CQC regulation on safeguarding by promoting a culture of safety, protecting the rights of the service user, and taking proactive steps to prevent harm and address any concerns effectively. So you want to ensure that you've looked at people, but also to look at the risks that are being managed. So that's just a brief outline of today's training, and I hope that you've enjoyed this training that I've given you today, because I want you to be aware of the new framework which came into place. It's been, they talked about it last year, and they said, okay, it's going to happen, and now it's happened February 2024. So we're already here. We're here. So if you are a new organization, for example, I want you to look at the new quality statements that go with your key lines of inquiries, for example. Okay, look at that. If you are already established, then you're going to be inspected, so you need to really start now putting this in. If you haven't done so already, you need to do it now so that you're not left short when the inspection happens, for example. So I've gone through some of the items of what's involved in submitting your application, and the key here really is for you to look at what I've talked about today. We do CQC application form submissions, so if you want your application done, we can do that for you. Just book a free 15-minute consultation here. My team will put the link in the chat for you to book a free 15-minute with myself so I can go through your CQC, whether you're just starting out or whether you are established. Maybe you've got a challenge that you're facing with CQC. There could be a restriction, for example. Then do reach out to us. Book a free 15-minute consultation. Like I said, my team's going to put the link in the chat here for you to be able to see. And what I also want to say to you is that we have got a training which we're doing, which is CQC training. It starts at the end of this month, and it is for those that are currently going through CQC or wanting to apply for CQC. So we cover the CQC application, but also we also cover the quality statements as well. So there's a lot of information that we have, but if you need your application submitted, then we do provide that service. So do book a free 15-minute consultation with us, and we will submit your application. Whether you may be in America, so America is different with home care. We can also submit home care applications in the States as well as in the UK. So do book a free 15-minute consultation with us, and we look forward to help support you in your CQC journey. I'm wishing you all a wonderful day. But we've also started on Monday coming up, we've got the 5-week challenge, which is about starting your medical staffing business. Whether you're in the UK or whether you're in America, you need to do this. It is going to be amazing. We've got some sign-ups already. I think some of you possibly might be here in the group as well. We've got sign-ups already, but we start on Monday. And it's $97, for example. The 5-week challenge, if you're interested in that, do also, there's a link here that my team will put in the chat as well. And I really am looking forward to doing Monday's training. I really am excited because it's going to be amazing. But also we're doing the training for CQC at the end of this month as well, and that is going to be a training in itself, because as you know, there's the quality framework as well that we need to be aware of as care providers. And if you haven't done it yet, you really do need to get that done, because you don't want to fall short, for example, with CQC. Okay, so I hope that you've enjoyed today's training. Do book a free call with us as well. We've also got the, like I said, the 5-week challenge that starts on Monday. Oh, hi, Katerina. So it starts on Monday. It's a 5-week challenge. It's for medical staffing agency business owners. So if you want to be a part of that, do let us know as well. But do book your free 15-minute consultation, and I look forward to speaking with you all very soon. Remember to really listen back to this video and look at the quality statements. Look at what is required of you as a care provider in the UK, okay? Because we do have people in America as well, which is slightly different from the CQC. Okay, so thank you so much, everyone. Do join the 5-week challenge if you want to start a medical staffing business. The 5-week challenge is perfect for you. The link is in the chat as well. But do book a free 15-minute call with us as well to discuss your requirements regarding CQC. I look forward to speaking with you all more. Thank you so much for being here today. I really appreciate you taking the time. Thank you. Have a blessed day, everyone. Goodbye.